For the past weeks, the Syrian army and its military ally Russia attacked the southern governorates of Deraa and Quneitra in Syria. They encircled some of the most important cities when it comes to the history of the Syrian revolution. And for civilians, once again, this was a tragedy. More than 250,000 of them decided to abandon their house and to wait under tents and also under shelters that they built with whatever they could find. And this area is located on the border with Jordan and on the border with Israel, and neither Jordan nor Israel, citing security reasons, decided to open the border for civilians. But mothers with their kids and kids who have chronic illnesses were allowed to cross in the pitch black of night the border between Syria and Israel under a scheme that Israel decided to implement in order to help all those kids who need daily treatment from doctors. Take a look at this report.
Clutching their children, scared and nervous, these women are crossing over into what they were told is enemy territory. In the dead of the night, Syrian women with their little ones in tow cross over into Israel under the watchful gaze of the Israeli soldiers. These women have stepped across a tense Golan Heights border to ensure that their children get the required medical help. They're not victims of war seeking refuge in Israel. They're patients with chronic health issues.
My feeling is fear, but when I came here, I saw something else. Not what they have put in our minds, not the same idea they told us, that they are enemies and Zionists and all of that. I saw the opposite.
A group of more than 40 mothers and children have crossed over into the pre-dawn hours of Wednesday. And they are among the 3,000 Syrians who've been treated under Operation Doctor's Appointment, a separate humanitarian aid program.
For me, I do not have any political affiliation, but because we are afraid of what Bashar is doing to us, we do not dare to go to the areas in the control of the regime.
Syria's medical infrastructure has been fractured in the 7 years of war, especially in the southwestern part of the country.
On the rebel side of things, the medical infrastructure is broken down. So as of the last year and a half, we've started taking in every 2 or 3 weeks, taking in a busload of non-wounded but chronically ill Syrian children.
Israel, like Jordan, had refused to take in any refugees from the war-torn country, citing security concerns. But it is not indifferent to the suffering of the Syrian people and has treated more than 3,000 Syrians in field hospitals on the border since 2013. In times of strife, humanity does exist, and this is proof of that. Bureau Report, WION.